Hey, everybody, welcome, and thank you for listening to this episode of Marriage Therapy Radio. My name is Zach Brittle. I'm here once again with Dr. Shannon Curry. This is a fun one. Today, we just kind of geek out on words. We go through a lot of different terms that are kind of popular in the zeitgeist right now. A lot of people in pop psychology are using all kinds of terms for all kinds of reasons, and we just kind of leverage our fake Ivy League degrees to talk about what we think these things are and make sense of them. Speaking of words, I want to invite you to check out my blog. It's called Stuff I Write. You can literally go to stuffiwrite.com and subscribe there. I'm trying to publish once a week, usually about non-relationship stuff. It's just a place for me to exercise some muscles. I've got a book proposal brewing, and part of that means I got to get back in the groove of practicing having things to say about stuff. Literally. So this last episode was about the movie Sinners. If you haven't seen the movie Sinners, I'm kind of excited about it. It's a great movie. And it's not really about the movie Sinners, but it's about some stuff that came up for me when I watched the movie Sinners. And I've got lots of ideas that are just brewing for me. And it would mean a lot to me if you would go over there and subscribe. And if you like what you read, share it with other people. It's totally free. So is, by the way, our Patreon for those of you who are members of Patreon, unless you want to become a paid member, which would be very cool. Help us keep the lights on at Marriage Therapy Radio. You can do that at patreon.com/Marriage Therapy Radio, or just go to marriagetherapyradio.com and click on the button there that says Patreon. It's a great way to support us, help us keep the lights on, help us keep doing very cool things, which include, starting next week, I'm going to spend the rest of the year basically just interviewing couples. I've got a whole bunch of couples lined up that have interesting things to say about how they make relationships work. I realize that I have this incredible privilege every week of talking to a variety of different people about a variety of different ways that they're making their relationship work, and that most people I know don't have the same privilege. They don't get to listen to a lot of couples. So I'm going to try and remedy that by letting you hear from people across the globe. Next week, the couple we have is from England, and I interviewed them while they were sitting in their home in London. And it was really fun just to hear them talk about their perspectives on things. I won't spoil it now, but it's very cool. Today, however, I'm with Dr. Shannon Curry. Thank you, Shannon, for coming on with me and for spending this last 3 weeks thinking out loud about relationships. And I look forward to having you back on sometime, maybe with Ty. But for now, this is a very cool conversation. Stick around.
I love your brain. I just love how smart you are.
Oh, thanks.
It's rare.
We should have you on the podcast more often to tell me how smart I am. Where did you go to college? You've told me before.
I started at Georgetown.
Okay.
Then I dropped out.
Yeah.
Then I went to community college for 4 years.
Mm-hmm.
Then I transferred into University of California, Irvine.
Yeah, right on. How long were you at Georgetown?
Just a year.
Yeah. My brother-in-law went to Georgetown.
It's such an awesome university, and I think for a long time...
Not a traditional Ivy, though, right? It's not an Ivy.
Yeah, it's not an actual Ivy.
But it has like this,
that
Ivy
connotation of... Yeah. It is such a cool university, and there are professors there that are just some of the most brilliant, fascinating, accomplished, highly engaged in governance, and just incredible people teaching there. I was studying medicine, though, at that time. I was pre-med, and it's not a great fit. I mean, if you go through their nursing program, which I did, it's phenomenal for pre-med because you're getting hands-on, basically practical medical exposure, even in your undergrad, which is usually unheard of. That was awesome, but it was very kind of East Coast old money.
Mm-hmm.
And I had been at an East Coast boarding school with a lot of rich kids, but I didn't realize they were rich because we were all such fuck ups. And it was just a bunch of rebellious kids, a lot of them from old money on the East Coast. But I really was blind to it. I didn't get it.
Did you listen to yourself on the podcast?
No, I didn't. I never do. I can't stand it.
Yeah.
Yeah.
Well, you spent the last hour talking all about your husband. I would think that you would want to check up.
Well, I'll look at it when it's good, like when it's ready.
Yeah.
Honestly, I'm going to tell you the truth. I don't remember getting it.
Yeah.
And you probably did send me a link, and I didn't look at it.
Oh, it's on the internet. It's like out there. It's like going.
Today?
No, the first one came out 2 weeks ago. The second one came out this week, and this one will come out.
I had no idea.
Oh yeah, no, you're all over you're like famous now. Yeah.
Wait, no, I did. I went to their website And I started it and I got distracted.
Yeah.
So I actually never watched it.
Yeah. Yeah.
And that should kick in any moment now. I'm so sorry. I'm so sorry.
It's okay. I'm running like crazy today myself. So.
Okay. What are you up to today?
What's that?
What are you up to today?
I had a bunch of meetings. Talked to one of your colleagues this morning because we share a client, and that was fun. She seems like good people.
Yeah.
And I always love knowing that my clients are in good hands.
I know what you mean.
Fun. It just means like, okay, I can, like, you've had this experience, I'm sure, where people come to me and go, well, my individual therapist thinks blah, 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 blah. And I'm like, oh man, I need to have a talk
I wish
with that
I could
guy.
say I've never had that experience, but I'm becoming like more and more of a crusader and more reactive to things like that.
What do you think?
I'm just getting jaded.
About, there's lots of different theories, but what do you think about people being in couples therapy and individual therapy at the same time?
I think that's great. I actually think look, here's the thing. If you're practicing a really solid evidence-based research couples therapy method, for instance, the Gottman method, one of the things I love about the Gottman method, it is probably the most research substantiated, I think, therapy that we have these days, like the most heavily researched happens to be for couples. And I use it with couples with substance use issues, with couples, service members with PTSD, et cetera. I find that the relationship itself can be we all know this, it's one of the most powerful teachers in life, right?
Yeah.
So if you have a really structured, effective couples therapy method where you're using the interactions with your partner and the emotional vulnerabilities, you're exploring like that one exercise, what emotion did you feel at that time? Rewind the video in your head, land on a time when you remember experiencing a similar set of emotions. And that's where you get to, some of the best individual work I've done myself, I will say, is using that exercise in my own relationship with our own couples therapist and realizing, holy shit, I am really sensitive to that. And I suddenly saw all sorts of interactions I was having differently, where I had this long route. I had this vulnerability from my own childhood experiences. And it was such an efficient way to identify that little wound that was getting in the way of certain decision-making and reactions. And it was just irrational, but it was so subtle. And it was the relationship, my partnership, that actually showed me what a big problem it was, because it was coming out in fights. If you're doing something like that, I think it can be incredibly powerful individually. Yeah. A lot of my clients, though, they've been working with individual therapists. If I have a client, for instance, here's when I think it can be really helpful for them to do individual therapy. If I'm doing Gottman method with a couple and we're doing all of that existential type self-awareness exploration in the context of working through conflicts they've had. But let's say I have a client who has anxiety disorder, a generalized anxiety disorder, clinical, diagnosable, and she really needs to be doing a lot of cognitive behavioral therapy to tackle some of those worry thoughts that are outside of the relationship. And just it's fantastic if she's working with a solid clinician who is really competent in that specific area and is also minding their scope of practice. That's fantastic. Sometimes I think it's problematic, though, because the individual clinician might, not all of them, but might have some takes on how the couples therapy is going or on the spouse. I find it really problematic when an individual therapist is saying something like that my client partner, who I am also working with, is a narcissist or something, without even truly understanding, it seems like, the diagnostic criteria of a label like that. And then it can be really, I wouldn't necessarily be working with the couple if that were the case and if that had come up in the assessment. So I think where that becomes problematic is if they haven't consulted with me and they're reaching that conclusion without sufficient information, and then it's actually interfering in the therapy, because my client really trusts their individual therapist. And when they come into the couple session, it's almost like I can tell they've had a session that week, because they are just not giving their partner the benefit of the doubt. That's problematic. And I think one thing that's important for the public to know is that in couples therapy, it is our duty to do a really comprehensive assessment before we start. And we look for clinical issues that may be problematic for the couples therapy process. And we have to really consider that before we delve in. So that is stuff that I would like more individual therapists to be cautious about and potentially consult or collaborate if they have that concern before necessarily expressing it.
Yeah. Interesting. You probably have thoughts too on the whole thing. This isn't where I thought I was going to go today or where we were going to go today, but you probably have thoughts right now on kind of the prevalence of this idea of like my husband's a narcissist, or there's narcissism, or that guy's a narcissist. Like, what do you like? How do you parse that at the kind of like the, okay, I mean, again, I'm imagining you have thoughts about it. What are they?
I'm imagining you have thoughts about it, and I'd love to know what they are, because I'm also imagining we're probably pretty aligned. I don't like sloppy diagnostics. And I understand that sometimes clinical nomenclature, this is a thing about me.
You got both vowels wrong. That's impressive.
Yeah, say it. Yeah. I read it.
Yeah.
I hear it in my head, or I never hear it in my head. I just understand what it looks like.
Yeah.
And then when I'm trying it out, it can be real rough.
Yeah. Yeah.
How does it sound? Correct me right now so I can imprint this.
It's nomenclature.
That's it. That's it.
Yeah.
Nomenclature. Yeah. All right. So when the clinical nomenclature is being just sort of tossed around, I understand that it can serve a purpose in terms of kind of having a shared collective lay meaning. Mm-hmm. However, it's become like the harshest insult, right? Mm-hmm. And it and fundamentally is misunderstood, I think, in the public. And I really get concerned when I see clinicians misuse it, particularly in social media forums and public forums. It is not that common, guys. We're talking like 2% of the population. So how do you know? When narcissism, I mean, studies have actually ranged from like, is it up to 10%? But that being said, these are really nuanced things, and a clinician wouldn't give that diagnosis without a lot of careful consideration of data from multiple sources. So we should not just be throwing that term around because of an inkling. That's my feeling on it.
So what do I do if I suspect that my partner is a narcissist? I don't suspect that Rebecca is a narcissist. But...
Good clarification.
Sidebar.
I mean, look, that's a loaded question, because if your partner truly has traits of narcissistic personality disorder, then you may actually be experiencing abuse, right? You may actually be experiencing some very problematic, harmful dynamics, demeaning, disrespect, not just criticism, but also contempt, name calling, manipulation, coercive control, jealous rages, right? So it's not so much, I guess I would say, what are you going through, right? Let's focus less on your partner. Let's focus on how you're doing. Is this working for your relationship? Is this working for you? Do you feel good? Is your partner, do you want to work on this relationship? What would you need to feel safe, to feel comfortable, to feel confident from your partner? And then I would probably suss apart, like, let's get realistic. Are these things that are genuinely within your control, or are you basing your happiness on someone else, right? It's a slippery slope. Like, are we saying that our partner needs to act a certain way to make us happy versus are we fundamentally in a situation where our needs and our rights, our individual rights and our dignity aren't being respected?
Interesting. Yeah, I think, like, if I have a take on it, this will sound like really maybe harsh or dismissive, but I'm like, does it matter?
Exactly.
What matters is, are you safe and sane in your relationship? And if you're not, then what moves do you have to make, or what moves do you have to invite them to make? And whether or not they can make those moves is really, I don't know. It's to be seen, I guess. The other one, of course, that everybody wants to talk about is gaslighting. This gaslighting me all the time. That's gaslighting me all the time. What do you think about gaslighting?
I'm laughing because I have a client I really love. He has autism, and he's really witty, very bright guy. And if he'll ask me like a definition of something, I know he thinks it's sus. He'll be like, what is gaslighting? And it's almost, there's like a childlike curiosity in it, right? He's bringing it up because he heard it. It doesn't make concrete sense to him. Something seems off. He's got a major bullshit detector. He wants to get my take. I love it. And that's one of those words he brought up.
Yeah, of course. It's all over the place right now.
You know, it's not an actual clinical term. Yeah. There's no set definition for what gaslighting is. Yes. There's no set agreed upon definition for what gaslighting is, right? I think same things with terms like codependence, which has no real research support.
Let's talk about codependency too, but we'll finish gaslighting first.
So a lot of these terms that get thrown away in pop culture or thrown around in pop culture that really have no agreed upon meaning. So sure, I mean, I have my own interpretation of what I think it means. But again, I think we get really stuck with labels and assuming that it means something when really, if you dig a little deeper, a lot of times people are talking about something really different.
Sure. Yeah. Okay. So what do you think it is? Like when you hear it or when you use it or when you hear clients use it, what is your base
say
assumption?
That my personal definition, okay, sure, not clinical, is or interpretation would be that something that you are perceiving that is valid and based on facts, based on objective, realistic facts. Somebody is trying to talk you out of what is actually true to evade responsibility. That would be my perception of, I think, what it's used most frequently to mean. But if somebody's saying that to me in a clinical setting, I'm going to ask, tell me more. What do you mean by that? Give me an example so I can figure out what do we do next? Yeah.
It's a pretty gentle definition. And I don't think it actually applies. I don't think it qualifies as gaslighting, at least in terms of the way that phrase was originated, which comes with a fair bit of malice. It's not just that I'm trying to get you to think like the thing that you think is factual, I'm trying to tell you isn't factual because you said
English professor.
Out of a failure of taking responsibility to
evade responsibility.
Yeah, to evade responsibility in the original sort of context, it was designed to make you feel crazy. It was something. The story is about a woman who knows that she puts the lights out every night, but he would put gas in the lights to make her think that the lights were out, even though they weren't. Or something along those lines. Like I won't quote it exactly right.
So it's a literary term.
Yeah, and it includes a desire to make you crazy.
Yes.
Which is evil and it's malicious and it's So when people come in here and they're like, "Oh, my partner's gaslighting me," I go, "Are they?"
I love that delineation.
Do you think your partner is deliberately trying to drive you crazy out of their sense of desire to harm you? Because when they can back off that, and pretty much nobody ever says yes, then I go, well, then you should leave.
Exactly. Same thing with narcissism,
out of this relationship,
right? Exactly.
You know?
Like what do you actually mean by that? And how are you doing? And is your perception of your partner, yes, that they are actively trying to harm you, maliciously, intentionally trying to harm you, do not have your best interest at heart. Yeah. And I think
no, that's not really what's happening.
Exactly.
I go, okay, then let's
then
take
it's
this
just different perspectives.
Term out of the vernacular. Right. Let's replace it with something like there's an evasion of responsibility, or there's a misunderstanding, or there's a realization that they think differently about things. And those things you can work with all that. You can't really work with, malice. For sure.
I love how precise you are with language. It's very scientific.
I have a very, I don't know if I want to hear about that, but I was talking to a guy earlier today about where my energy is and where my passion is. And right now, relationally, the best example I have is with Abby, the 22-year-old who is dating this guy, and he's a good guy. I like him. I like her when she's with him, which is kind of
that's wonderful.
That's kind of like my bigger thing. I'm sort of like,
she's doing
she
well.
Had this other guy that she dated, and I didn't like him, and I didn't like her when she was with him. And I was
you know what? That's a good guide for all of us.
Yeah. I'm just like, I like you better when you're with him. So sure. Yes. But he anyway, doesn't have the same vocabulary that she has. And she's cursed because she's raised by me and she's a woman and she's socialized to be relational, all that stuff. But I think what he doesn't need goodness instilled in him. He needs words.
Right.
He needs vocabulary. So language,
Right.
I think, is the gateway to understanding
Mm-hmm.
more. And I sort of always say the same thing. If you tell somebody a story about Spider-Man, and everybody knows the story of Spider-Man,
Mm-hmm.
but you use 500 words, it's a pretty simple story. It'll be true, but yeah, only a couple characters and a couple of motivations, but you use 500,000 words.
Yeah.
Same story.
Yep.
Much more true, much more nuanced, much more complex.
Richer.
And so I think people who don't have, I don't want to say precise control of language because that feels too hoity-toity. It feels too old money, but like people who don't have access to more language or precision around their language,
right?
The stories they're telling themselves aren't as true as they could be, and they're not as true as they should be.
Or accurate. I think having
accurate.
the right language or choosing the right, ensuring that you're using the word you intend to use, right?
Yeah.
I think it is. I think the reason I said scientific is because specifically when I'm doing forensic work, it is so important to use very precise language to not overstep your role in terms of the law. Mm-hmm. Everything really needs to be careful, cautious, precise, minimal, and above all, relevant to the particular legal question. There are so many potential risks, right? So mischaracterizing data, misleading the jury, saying something that could be prejudicial, stepping over your role as an educator that is truly just presenting the data in a way that's digestible and helps the fact finder. If you say something, even use a word that's a little too salacious, or share something about, like, I think it's heartbreaking. I once actually did that in a trial when I was talking a lot about how you can see some of these childhood risk factors and you can see them on report cards. And I then got less precise. And I said, and sometimes it's heartbreaking. You can see these report cards. Was what I was saying compelling? Yes, because it with that kind of personal perspective. Was that appropriate for the courtroom where I need to be very unbiased, ensuring that I am truly just there to present data in a digestible way, and the professional humility of, this is for you guys to make your decision. I really respect precision for that reason. And I think it's hard, and it's kind of a constant inner checking, and it's respectful of others. So
all right.
I think that's what I mean by science is respect, humility, and really putting truth and accuracy above all else.
Okay. So now let's take that over to codependency. How do you understand, or how do you define or navigate?
There is no definition for it that's shared. I don't use that phrase, frankly, because I've seen it become very harmful in cases that I've worked on, forensic cases, particularly from therapy notes or, some sort of records that are being brought in to support somebody's position. And it is not a definition that has been agreed upon in any forum. So it's used a lot in 12-step programming, but it just is not substantiated. And then it can also be really problematic culturally. So whereas it really it's used more often in contexts that are very Western, white, individualistic. And so it's sort of, and I would say that it tends to be used in situations where it has a negative connotation and pathologizes behavior in which somebody is relying on another for support, or over relying on another for support or validation or whatnot. That seems to be those. I'm giving one example, but I've seen it used in a lot of ways. Either way, it tends to have a negative connotation. And I find it to be really problematic and prejudicial when it's brought into forensic cases. But I also think it's problematic and prejudicial and really disregards different cultures and values when it's brought in the therapy context too.
Yeah. I think if I go to just the actual word, it's this idea that we are codependent. We are dependent together. We just like we're cooperative, or we're co-parents, or whatever. And I think there's actually, like, what I sometimes will do with codependence is I'll say, that's good. That's good.
I love that. I love how you do things like that.
Should be codependent on each other. but I think that's not what you're describing. What are you describing? And
Well,
then we
I
hear
think
about,
it's usually used. So when I've heard it used, particularly I'm thinking of when I've seen it in therapy notes that I've reviewed in cases, it has been used in a pejorative way, sort of to suggest that
describe what? Yeah.
To describe a relational dynamic between partners that, or if one partner has a substance use or an alcohol use issue, the other partner is, if the other partner is not behaving in ways that the treating provider believes are setting firm enough boundaries or are really instilling consequences enough. If that other partner isn't leaving when the clinician felt it would be appropriate to leave, or when the partner who has a substance use problem is relapsing and the other partner isn't being firm about like, you have to leave or something like that, that's when I tend to see that word used to describe the dynamic between that couple, that they are codependent on one another. And usually the insinuation is that the partner who won't leave is codependent on the other partner, even though that other partner is assumed to be bad for them because of the substance use issue or because of the alcohol use issue, which is also very pejorative, because there are so many different degrees. And again, it comes down to, is this a problem for you? What does your value system tell you?
What are you actually complaining about?
Or exactly.
And I've complaining, but like
I've run into this. Yeah, I've run into this where the person actually didn't have a problem with it and really loved their partner and didn't even believe that what was happening was that problematic. They thought their partner had a problem, but that in terms of severity, it was much like anybody else's problems in life that they're trying to tackle. And yet they felt very pressured by therapists to break it off or kick them out or, this sort of thing. And then they constantly felt this pressure because they were failing. So they would engage in these sort of over, what the individual client felt was like an overcompensatory strictness, or it really created a rupture between them. It really created a rupture between a couple that were otherwise incredibly trusting with one another and really dear friends and talked about things openly, but they felt like there was a way they should be handling it that wasn't intuitive to them. And yet they were trusting a therapist who was essentially relying on a term that was not evidence-based.
Yeah. Yeah. It just requires examination. That's kind of my thing anyway. Like somebody says something and I'm like, I don't know what you mean. Tell me what you mean. Like,
I love how you do that.
Do that
I
a
love
lot.
how you do that. Yep.
Another word you just said that I just kind of have become much more clear about abandoning is should. Like I hear people describe things that should or shouldn't happen, or that their partner should or shouldn't do, or that they should or shouldn't feel. And I'm like, where does should come from? Like,
yeah. And what we should be doing and shouldn't do. Shoulding all over ourselves. I love that term. Was that Beck who came up with that?
I don't know.
Shoulding all over ourselves?
I know that my mom's therapist said that to her in 1990.
Yeah, I think it was Beck.
I was like, okay.
Can I look? I got to look it up. I want to get this on the record because it has to do with cognitive behavioral shoulding. And it was somebody with a good sense of humor who gets credit. Shoulding all over yourself.
Yeah, I think for me, it comes back to how like contempt works. So, I say this especially to men. I'll say anything that you have decided puts you in a position of authority over someone else, or puts you in a position of hierarchy over someone else. Any criteria. I'm a man, I'm wealthier, I know more Game of Thrones trivia, I'm nicer, it doesn't matter, is made up by you. It is created. It's an artificial construct. And so that's the way I feel about should, because should enters the chat.
It's an extra
and you're like,
layer.
Wait a second, who decided should? And
it's
now you start to have all these conversations about, well, my parents, or my first partner, or well, da-da-da-da.
And that's really beautiful work right there.
Yeah.
It was Albert Ellis. Albert Ellis.
Oh man. Some of these names, of course, I haven't heard since I was in like Psych
licensing
101.
exams. Yeah.
Albert Ellis. That's hilarious. Who's the other guy I'm thinking of? Who's the unconditional positive regard guy?
Oh, Carl Rogers. That was my guy. That was my comps exam. I chose humanistic therapy. I love humanistic. But that's okay. So humanistic, actually, what you just described.
Okay.
you do humanistic beautifully, because
Look at
Carl
me.
Rogers was all about,
I'm Rogerian.
you are, he was all about essentially putting on somebody's entire worldview, just completely removing your own lens and being fearless and just unconditional positive regard, total genuineness in your interactions, and then empathy. Empathy.
Yep.
Empathy.
Close.
But the radical empathy, I think, was pretty incredible, because he was always just asking questions. Well, like, where does that message come from? Who says?
Yeah.
Right. Yeah. And that was very similar to just the idea that should and shouldn't is an extra layer that has really nothing to do with our own values. And usually it's just some preconceived notion that we haven't really explored very fully.
Okay. I got another word I want you to mess around with. Empathy. What do you think of? Just kidding. Empathy. Like, what's your take on empathy?
Empathy.
How does it work? Is it the right word? Is it the right tool?
I want you to go first, because you always have a better answer than I do.
Well, the reason I'm asking this question is because I've been getting to know Sarah Nasserzada's work. I don't know if you know who she is, but she's
I'm going to sound
out of
dumb.
Southern California. She's brilliant. And she wrote this book called Love by Design. And she talks about, in that book, she talks about how empathy it's overrated. It's the wrong tool, because and she's not anti-empathy, but she's pro-compassion.
Okay.
Vis-a-vis empathy. So empathy requires you to feel what the other person feels.
Right.
So if you're sad, I have to feel sad in order to meet you where you're at, versus compassion says, man, that's really lousy that you feel so sad. And
see, I always thought empathy was defined that way.
Well, it could be semantic, right? We could just be parsing qualities, but there is something about empaths.
And I thought of sympathy as the way you just defined empathy. I thought that was the difference between sympathy and empathy.
Yeah. And Brene Brown does a whole sympathy versus empathy thing. Yeah. But you think about these empaths. They are like, oh, I feel what you're feeling. And now all of a sudden it's about them.
Right.
You know, versus people who have compassion and they can truly make it about
the other.
Yeah.
You know, I wonder, I do like the semantics of that. I do think compassion captures more of the action, compassionate action. For some reason, I think, but again, I think we're talking about semantics, and there may be listeners who are just ready to like drive off a cliff after listening to us dig into words. But I do think compassion, for some reason, it does feel more active to me, like an act of compassion. It's truly about the other.
That's okay. I think about this episode. This is what I'm thinking about this episode. It's sort of like a dictionary, and you just like flip to a page and you're like, oh, what is the definition of this word? Or what is the definition of that word?
And what is not the definition?
Yeah, what is not the definition? I got another one.
Okay.
In the context of affair recovery or betrayal, do you have a principle or a practice for how you label each partner? So like...
Oh, God, I have not landed on anything I like.
Okay.
What do you do?
Well, there's
amazing
lots of different
question.
There's lots of different ideas about it, and the one that I think I'm most comfortable with theoretically, but least comfortable with semantically, is involved and harmed. So, like the involved partner and the harmed partner. That actually, I think, comes out of John and Julie Gottman's work, in part because there's an effort to not pathologize or
turn
somebody into a betrayer and a betrayed.
Right.
And then of course there's even more pathological language like cheater.
Right.
You know, or but people have roles. They have roles in this thing, you know, and in fact, particularly when it's an affair, somebody comes in, someone is involved in an affair.
Right.
And someone has been harmed by that.
I mean, I literally
just don't think it's very sexy language.
I do whole sentences. I'm like, so you were the one that had the affair and you were the one that found out about it. And I mean, I am literally labeling them like that. You, the one who found out about it. And so.
Yeah. And I don't actually, of course you probably have couples who come in and like, they want to debate the word affair. Well, it wasn't an affair. It was it didn't.
Not usually, actually.
Yeah.
Not usually.
Oh, man. Well, people, I mean, it's just like, who wants to own it? Not a lot of people, right?
You know, I think either I have complete denial of an affair And then there's busted. And then I haven't encountered anything that's really on a slippery slope. Either it's busted and it's bad. And a lot of people come to me after it is factual. I mean, it's out in the open.
Sure.
They know there's been full confession, kind of a thing.
Yeah. It just, so I abandon it pretty fast because I'm like,
you don't want to get stuck in the weeds with
I just
that.
go, does it matter?
Yeah. Again,
like,
right.
We can call
you
it whatever
feel betrayed.
You want.
Right.
You feel betrayed and you have some repair to achieve. And
same thing with addiction or substance use problems,
it's
right?
Exactly the same point.
It's the same point.
Somebody comes in and says, "Oh, he had an affair," and I go, "No, I didn't. It was just some flirting with a call girl." And I'm like, "Does it matter? Like, she didn't sign up for that. Like, so you sign up for X, you get Y. That's a breach. And that breach needs repair. So we can debate all day long if we want to label it different ways, but I do try to like depathologize it as much as possible, in part so that you can get both people on board.
Right.
You don't want one person, perhaps the involved person, sitting there the entire time trying to defend themselves against, the lack of precise language,
Exactly.
Or
it's
language that is more precise than it needs to be.
I focus more on the behavior. Is this a problem for you? Is this a problem for you? Okay, so it's a problem for you guys. We got to figure this out. And sometimes I think it's really interesting I've had couples where we even have to get into kind of uncovering. I mean, really, we're talking about like some perpetual problems in what they consider freedom, what they consider their ability to be social and free, what somebody considers to be inappropriate, even porn, right? So you get into these kind of existential type explorations about sexuality, friendship, and that stuff can get really heavy. And then I focus on that like any other perpetual issue that we're trying to figure out, understand deeper values around, and then come up with hopefully a compromise. Sometimes that compromise is far more in favor of the other person because the relationship will end otherwise. But we're trying to come to a solution that they can live with.
Yeah. I could geek out on words all day long.
I could do. I love when you define them.
Yeah, it's kind of fun. I mean, I think it's important to kind of know what you're talking about. And sometimes when clients are in my office and they're talking and they're just kind of, it happened today, so talking. And I was like, they're like, so she looked at me in the eye. She goes, am I making any sense? And I was like, not really. I don't have any idea what you're talking about. I don't know what you are trying to accomplish or what you want. Like, I'm just not. So is that helpful?
That's genuine, right? It's genuine.
Yeah.
And that's some in vivo shit.
Yeah.
Can I swear on this?
I guess you can because you have. What does that mean, in vivo?
Real life, sort of like in real life.
Oh, yeah, sure.
Dynamic is the therapy. Yeah.
Yeah, totally. I think that's probably my did. So I'm an in vivo Rogerian couples therapist, I suppose.
Yeah. You're doing good stuff.
Okay, this will be my last question. What do you know about couples who make it versus couples who don't make it?
Do you need me to do tutoring towards statistics and bids?
No, I just want,
is this like, in my own life?
When your gut kicks in and you're like,
oh,
you guys are going to be okay, versus when you're like, no, not going to work.
Oh, 100%.
Like, what do you know about the difference between those?
This is the real therapist talk, right? This is
that's what I want.
Stuff, that the listeners actually are getting a peek on. Yeah, I mean, look, do they like you? Do they want to make it work? Is there love there? I've had clients where it's not therapy, it's babysitting, right? They're using that time. It's the couple that it's not okay for the sessions to be further apart because they cannot or don't want to work on things together. Like their partner is the enemy. They are so far away from that idea of you and me against the world. Like if they like me more than each other, or they're relying more on me than each other. And we talked last time about the opposite of that, where there's triangulation and I'm like the enemy. But I mean, if truly I'm looked at as like, you'll have a better phrase for this, but like a savior from their partner, right? there's just this chasm.
Yeah, a proxy or a surrogate kind of.
Yeah, like they don't even want to give their partner the benefit of the doubt. The couples that really are easy to work with, the ones where you can give them some facts and they take it, they implement it, and you see growth pretty quickly. Those are the ones that come in really wanting it to work, both of them. They want it to work, and they're not going to burn it down every time they walk out of your office. And I have couples that truly, like, it's almost just I don't care, F it. Like, they walk out of the office and they'll do everything to burn it down, to hurt their partner. I just don't see the effort. And I think, if they are truly trying and eager, there's like an eagerness to learn. They want to be here. They want to learn this stuff. They're just as pumped on it as I am because they want the hope. That's a really good sign.
Yeah. All right.
What do you think?
For $1. I'm sitting here thinking about if I have an answer to my own question. I definitely can clock within the first half hour or so whether or not a couple is going to grow or change or make it.
What do you pick up on?
Well, that's the thing I'm wondering about. Like sometimes I wonder, like, because here's the reality. Let's say I clock it and I'm wrong, and I give up on them before it's fair, right, or good. And I don't think that happens very often, but it certainly could. In fact, I tell clients all the time, I'll hang in there longer than you. Like, I don't. Yeah. But for me, if I think about one thing, it's that they're not creative.
Interesting.
Like couples that are going to make it, they have to be willing to think creatively about the trajectory they're on and believe in the idea that they can be on a different one.
Rigid.
Yeah. They're not rigid. I mean, there's a woman that I like, that I read. Her name's Jane McGonigal. I don't remember if I told you about Jane McGonigal already, but she does this thing where she talks about episodic future thinking, which is, I sneak up on people because I say, have you ever heard of EFT? And they're like, yes, I have. It's emotional focus there. I'm like, no, it's episodic future thinking. But she says, imagine where you're going to wake up tomorrow. Can you do it? And you can. You're going to be in your bed. Ty's going to be there. It's going to jogs or whatever. Okay, how about a year from now? Yes, I can imagine that. Probably same house, probably same people. Main characters are the same. Probably going to smell the same. Lighting's going to be the same. What about 10 years from now? And then all of a sudden your brain goes,
well, yeah.
I don't know. I don't. Maybe I'll be in the same house or maybe I'll, and it's that gap between say 1 year and 10 years that our brains have to access imagination and access creativity. And that's cool. That's where change comes from. That's how novels get written. So Jane McGonigal, she sort of goes, imagine a world where there's no water, or imagine a world where high school students go to a wizard school if they have a special capacity or whatever. And then these magical creative stories get written. And if your relationship is going to change in a way that doesn't look like it looks now, you have to imagine a world where you're really deliriously happy, or a world where you're having great sex, or a world where you're kind of not having the conflict that you had before. And then your creativity has to kick in.
Do you think hope can do that?
No.
Just the hope or the desire?
No, I don't. And I think it's, and because it's this, because I think there's like when I think about creativity and hope, I put them kind of in the same category as like capacity and desire. Like you have to have both. You can't have one or the other. You can have all the hope in the world and no creativity. You're not going to make it.
Right.
You can have all the creativity in the world, no hope. You're not going to make it.
What about willingness? Like maybe you don't know what it will look like because that's why you're coming to the therapist, but as you're learning, you're willing to try whatever they're suggesting.
Well, that's creativity.
That kind of flexibility.
That's outsourcing. That's outsourcing your own capacity. And
interesting. Okay.
Somebody else can do that. I mean, it's like going to a painting class and saying,
right.
I'm not a good painter, but I'm good at imagining how to be a good painter, so I'm going to take this class.
Okay. See, that's what I think I am talking about. And you just, yes, it's the couples that are. And I think that's one of the problems with somebody coming in certain that their partner is a narcissist. It's like, so what does this look like for you? Why are you here? Why would you want to improve your marriage to a narcissist if you're so certain that this person is a narcissist?
Yeah.
It's pretty awful.
Certainty is a killer for sure.
Yeah, exactly. So that flexibility, that hopefulness, I think a little humility in the relationship, or about knowing everything about your partner or your relationship. When I see people like that, like I love working with them They're such a joy.
Cool.
And they do better. It's awesome. I had a couple today.
Listen,
they're really happy.
Thanks for hanging out with me. This has been really fun. I'm glad we got to squeeze these in. And
we're going to put your editor to work on this one. I apologize.
No. There's nothing to edit. We're just shooting the shit. We started Marriage Therapy Radio, Laura and I did, because we were out at bars talking about this stuff. Mm-hmm. We're like, wouldn't it be cool for somebody to be a fly on the wall and just listen to us talking? And then that's exactly what we did today. We just like talked, geeked out on stuff, and somebody is a fly on the wall and they're just listening to it. And that, they can turn it off if they want. I'm not worried about it.
You're so
right.
cool.
Cool. Listen, I really appreciate you, and I'm glad that we're friends, and I'm glad that you came on my show. And yeah, we'll talk more soon.
All right, buddy. See you soon.
Okay.
Bye.
Okay. That was Dr. Shannon Curry. Thank you, Shannon, for coming on and for batting around ideas with me. I love talking to her, particularly because of how clinical her brain is. She really thinks through things through a lens that I don't use a lot, and it benefits me when I get to spend time with her and others like her who are very serious about doing clinical work. Again, if you have a minute, roll over to stuffiwrite.com. Check out my personal blog. You can support Marriage Therapy Radio by doing that at patreon.com/Marriage Therapy Radio. I can't overstate how important it is to have people getting behind the podcast financially. So thank you for that. And then, of course, another way to support us is by paying attention on social media, liking, sharing, all that stuff. Just helps us stay relevant and continue to bring cool content your way. For now, I will thank you for the time and attention you're putting into making your relationship better today than it was yesterday.